views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
I'm just so grateful to be here with everyone, to be in the presence of our borough president, and to be with community members and community partners here today in honor of National Transgender HIV Testing Day. Before I want to get started by opening up, sharing a couple of words really about what this day means to me, and about reaffirming for you all the importance of HIV testing and action, intervention, and prevention within our community, especially for those individuals who are trans and gender nonconforming and gender non-binary, especially for those individuals who are Black and Latinx and of color. So let me introduce myself first. I am Mimi Shelton. I use she, her pronouns. And I am the Director of Trans Initiatives and Services at Destination Tomorrow, again, which is the Bronx LGBT Center. So as an organization, Destination Tomorrow is a holistic wraparound service agency that works to provide the necessary resources for individuals within the LGBTQ+ community within the Bronx borough to have access to the resources necessary, whether that's housing, whether that is medical care, whether that's behavioral health care or otherwise, so they can get to whatever their next step is, whatever their next goal is, to get them off of the path of emergency moments and crisis situations. So we continue to do that work today, and our HIV testing day is important for that. For this day, I just want to say, I remember growing up, I'm from Louisa County, Virginia, originally, so I'm a Southern person, a Southern woman, and I remember growing up, and the first two things I learned about what it meant to be gay or what it meant to be trans was that you were diseased and you were wrong and unworthy, in so many words. And I think it took me 28 years, but I can finally stand here today and understand and tell those in my community that we're not diseased, we're not a disease, and we're not worthy, we're worthy, right? I am enough, you are enough, we're all enough. And not only we are enough, we're worthy of proper care, access to intervention and prevention services for HIV. And we're also worthy of people's not just tolerance, but people's acceptance, people's concern, people's trust, right? So now, with those words being said, I would love to introduce a really awesome woman, a really beautiful woman, a really powerful woman, and a woman I respect thoroughly. Everyone, please give a round of applause, and please welcome and honoring the Bronx Borough President, Ms. Vanessa L. Gibson.
Thank you so much, Mimi, and good morning to each and every one of you. Thank you for being with us. Thank you for sharing your story and your testimony. What an honor to be here at Destination Tomorrow, Barnes Avenue office here in the Morris Park community. I am grateful to be here. Bronx Borough President Vanessa L. Gibson. My pronouns are she, her, and hers. And I welcome all of you to our very important press conference as we recognize today as National Transgender HIV Testing Day. I am excited that we have with us our partners at Amita Care, as well as Essen Healthcare and Destination Tomorrow. For my time serving as the Bronx Borough President, just in these short 4 months, but certainly during my time for 8 years as a member of the New York City Council, we have been working very closely together. Amita Care, Essen, we've opened new healthcare centers, FQHCs. We've done so many resource fairs, family days, and my favorite, Zumba classes. Very popular among our older adults. And now I was just sharing with Sister Sandrine that our children are asking for Zumba classes as well. And I think it just highlights and underscores that When you talk about health disparities, when you talk about addressing some of the issues that are so prevalent in Black and brown communities, we have to make sure that we talk about access, opportunity, education, outreach, resources, programs, collaborations, and partnership. So I want to thank everyone for being here. Certainly we want to thank BronxNet for their live stream of today's press conference. I want to recognize News 12 Bronx, Norwood News, Telemundo, the Bronx Chronicle, and Hostos Community College. I also want to recognize representing the Bronx and Ending the Epidemic. We have our chair with us today, Charmaine Graham. Thank you so much for your support, and really each and every one of you. Each one of you has truly been a partner since my time in the New York City Council in combating the health inequities that have for far too long plagued our borough. I am here today, this morning, to call attention to another health-related issue in our very community. We are here today to highlight the health disparities that are faced by our transgender community here in the Bronx, and to raise the awareness of an ongoing health epidemic that disproportionately affects our TGNC neighbors, HIV. Historically, the trans community has experienced marginalization as a result of years of systemic transphobia and racism in our nation, and has truly found it difficult to get high quality and culturally competent primary care. This has rendered them less likely to access testing sites, and unfortunately has made the community more susceptible and vulnerable to HIV infection. It is astounding that transgender women are 49 times more likely to be living with HIV compared to the general population. As of 2020, according to the New York City Department of Health and Mental Hygiene, the Bronx had the second highest number of new HIV cases and diagnoses, and the highest percentage of HIV-related deaths. We must not let this pattern persist when early HIV infection is detectable and preventable. Unfortunately, during these 2 years of COVID-19, HIV testing has also slowed dramatically. In 2019, HIV testing here in New York averaged well over 2,500 tests per month. By April of 2020, that number dipped below 500 tests per month. By June of last year, testing had not surpassed 2,000 tests in any given month. Testing saves lives. Testing saves lives. Testing saves lives. And I repeat again, testing saves lives. And I am committed and dedicated to reducing the spread of HIV in the Bronx and making sure that our brothers and sisters who are living with HIV continue to receive the quality patient-centered care, affordable and stable housing, which we know is important, that every New Yorker, regardless of their gender, their identity, truly deserves and is entitled to here in our city. That is why today, as your Bronx Borough President, I am issuing a proclamation declaring that today, April 18th, is National Transgender HIV Testing Day in the Boogie Down Bronx and here at Destination Tomorrow. Yes, we are declaring it. Let this day always serve as a reminder to our friends, our family members, our loved ones, our relatives, that can be saved from harm by simply practicing regular surveillance that includes HIV testing and early treatment options like pre and post exposure to PrEP and PEP. It is one of my highest priorities to reduce health disparities in the Bronx and to enhance what I call health literacy. But we need partners like Destination Tomorrow, like AmitaCare, like Essen Health, and so many others who are on the front lines every single day. I was on the front lines with many of our partners during the pandemic. We were out in these streets giving out PPE, giving out hand sanitizers and testing kits, and making sure we had testing sites. We opened up Yankee Stadium as the largest distribution of the vaccine here in the Bronx to make sure that New Yorkers and Bronxites had access to testing. And we also made sure that the booster shots were available. And although 2 years has passed and we believe that COVID is behind us, we take nothing for granted. We know that there is a possibility this week that our status as a city will move from low to medium because of an increase of COVID positivity cases. So we still have to be very careful, neighbors. We still have to get tested. We still have to make sure that for those that are not yet vaccinated, they do get the vaccine. I also want to announce today, on April 18th, the relaunching of the Bronx Borough President's LGBTQIA+ task force in our office. We had it before, and we will now have it once again. And our goal with this task force is to bring together experts, advocates, all of our community partners to problem solve, to be strategic, to plan, and conduct outreach to the Bronx, to our LGBTQ+ community around the Bronx, from neighborhood to neighborhood, to provide quality health care, mental health, trauma-informed care, wraparound services, holistic services, and also implement policy work. I was very proud during my time in the City Council to be a part of creating the Trans Equity Initiative in the City Council, in which we give millions of dollars to organizations in the 5 boroughs that serve our LGBTQ brothers and sisters. And now I'm so grateful that in the adopted budget, Governor Kathy Hochul and our legislative leaders have also implemented millions of dollars towards the LGBT community. We must make sure that resources are truly available and that we provide so much services that are necessary. And we start by testing, making sure that testing is available. So I also want to mention that from our office, Alexis Ruiz on our team will serve as our liaison to the task force and is making her rounds. Alexis is here now. Raise your hand, Alexis. Alexis is going to be our point person for the LGBTQIA+ task force in the office of the Bronx Borough President, and she will send out her contact information once we get back to the office. But we are truly excited to continue this great work that was started by my predecessor, number 13, Ruben Diaz Jr., and our former Director of External Affairs. Many of you may remember Dirk McCall. We cannot do this work alone, family. We need all of our partners. We need each and every one of you, because at the end of the day, our job and our responsibility is to save lives, to keep our neighbors safe, to provide the access and the opportunity that is truly necessary so our families can be strengthened, our people can be uplifted, and we can continue to provide education. I often say, if you know better, you do better. And we have to make sure that our residents have the accurate information, and we are not afraid to share that. And so I want to thank my team, my staff who is here, our Director of Communications, Michael Ivory. Thank you so much for all of your work, Michael. And I also want to recognize our Director of Health and Human Services, who is responsible for all of our health policy work, including our work dealing with opioid, dealing with maternal mortality and morbidity, dealing with health disparities, creating a Bronx birthing center. I'm putting all of this on her shoulders because she is ready, willing, and able to do this work. Dr. Nancy Keck, thank you so much, Nancy. And with that, I truly want to thank all of you for being here. We have trucks outside provided by Essen and Medicare, as well as DT. Thank you so much for your relentless efforts every single day. You understand that outside of a press conference, we're doing this work every day in our communities here in the Bronx. And I'm so grateful for all of our advocates that have turned their pain into purpose, that are reminded that in the middle of a storm, we can find strength. Together, we can achieve any and everything that we put our minds to. And as your borough president, I will never give up. I will never stop trying. I will always be with you. I like to say in these streets, because it's important that we reach our clients where they are. We don't expect them to all come to our doors, to come to our offices for fear of being, just stereotyped and all of the different perceptions. But we want to meet our clients where they are in a very culturally sensitive way, in a language diverse way, whether they may speak English as a primary language or any other language. We have to meet our clients where they are. So once again, thank you all. Thank you, Amita Care. Thank you, Essen. Thank you, Destination Tomorrow, for your partnership, for your collaboration as we end the epidemic and do our part to save lives of Bronx residents here in our community. Thank you so much.
Good morning. Good morning, and thank you, Borough President Gibson. You are amazing. Thank you for being a partner to Amita Care, to Destination Tomorrow, Essen Health, and so many of the other great organizations that, as you says, has boots on the ground. In the streets, right? And especially thank you for all that you do for our Bronx residents. My name is Sandrine Blake. I'm the Assistant Director of Events at Amita Care. Amita Care is the largest Medicaid special needs health plan in New York City, and we specialize in caring for people affected by HIV. Almost half of Amita Care's members are Bronx residents, and nearly a quarter of our members are of the transgender experience. Thanks to the leadership of elected officials like Borough President Gibson, New York State has made enormous efforts and progress in ending the HIV epidemic. Recent data shows that there's continued decrease in the numbers of new HIV infections. But on this National Transgender HIV Testing Day, a day to focus on HIV prevention, treatment among the people of trans experience, it's important to note that there's still work that needs to be done. We still have a lot to address with the disparities that our communities are facing. The HIV epidemic has taken a heavy toll on the Bronx. As Borough President Gibson mentioned, data from 2020 shows that the Bronx has the second highest number of new HIV diagnoses out of any borough, and the highest percentage of HIV-related deaths in the city. The trans community is also severely impacted by HIV. Transgender women are 49 times more likely to be living with HIV compared to the general population. This is a particular issue for transgender women of color who account for almost all new HIV diagnoses among the transgender women in New York City. Since the COVID pandemic, we have seen that fewer New Yorkers have been getting tested for HIV, and we have to put a stop to that because we have access to care. There's testing vans, there's testing sites that we need our community to know are available and ready for you. We want our trans brothers and sisters to know that HIV is not a death sentence. People living with HIV can become virally suppressed with treatment, and we know that when HIV is undetectable, people can live their healthiest, best lives and cannot transmit the virus to others. That's why it's important to know your status and get engaged with treatment. So getting tested is just the start. You can live a healthy, productive, viable life. For people who are HIV negative, we need to increase access to PrEP, pre-exposure prophylaxis, to prevent the transmission of HIV. PrEP is a treatment that is highly effective in preventing HIV transmission, so please get tested, learn your status, and talk to your healthcare provider to decide if PrEP is best for you. Bottom line, today is a day to highlight that we need to reach New Yorkers, not just our fellow Bronxites, but all New Yorkers, and our fellow brothers and sisters in our trans community to get tested. Those who are placed at elevated risk for HIV, as well as those who we need to keep engaged in care. We need your support in highlighting the importance of this day, in highlighting the importance of getting tested. We can't stress this enough. We thank Essen Health for their testing van that's right outside. We thank Destination Tomorrow for this beautiful site that has testing available on a regular basis. And we thank our community partners who are in the streets, boots on the ground, and getting our community the access to the necessary resources that they need. I would like to bring up now from Essen Health, Dr. Bintu, to speak to you a little bit more on this day. Dr. Bintu.
First and foremost, thank you everybody for being here today. Thank you to Destination Tomorrow, to Amita Care, to Borough President Vanessa Gibson, everyone for being here and speaking on this important day. As we just discussed, today is National Transgender HIV Testing Day. The previous speakers had thrown out a few facts, and I just wanted to give you a few more, just so everyone understands why we're all here today and what's the importance of today. The CDC had done a survey that showed that 42% of transgender women in the 7 major U.S. cities were living with HIV. Furthermore, if we want to extrapolate that data and look at the disparity, African American population and the Hispanic Latino community, the transgender women were almost 65% of them were living with HIV. So that speaks volumes to us here in the Bronx community for us to do even more so to open access to care. Here at Essen, that's our #1 goal, access to care. All of our urgent care sites, all of our primary care sites and specialty sites, all of them serve for access to care for all of our patients here in the Bronx. In terms of HIV testing, our urgent care sites offer rapid HIV testing now. Anybody can come in. It's confidential, it's fast, it's reliable, it's effective, and most importantly, as we just discussed, the importance is to find out your status so that we can then start treatment. Testing is just the first step. We have GYN care and infectious disease specialists here at Essen that are more than willing, to take on anyone that comes through the door to help them to the best of our ability. And so the first step is testing. Once we can find out your status, we can then start by offering treatment. We've come a long, long, long way from when HIV was first discovered back in 1990. Back then, it was considered a quote-unquote death sentence. Now, if you find out your status early, we can offer treatment, and everyone is able to live a long, healthy life, especially as we discussed with viral suppression. So very, very, very important. As I mentioned earlier, our goal is access to care. That's why today outside we have our testing vans. We're offering both COVID testing, as President Gibson had mentioned earlier. The COVID rates are going up, so it's important that we understand the climate of today's environment and how COVID deters us from accessing care. So we want to make sure here at Essen that we partner here with Destination Tomorrow, with Amita Care, and all of our other local partners to make sure that all patients have access to care. Please come into our sites. Please get tested. Please find out your status, and let us be able to help you to try to reduce the rates of HIV transmission here in the Bronx and try to lead to an overall healthier population for the transgender community. Thank you for your time, and thank you for having us here today. Much appreciated.
Thank you. I'd like to introduce Leilani Munez. She's not only at BronxCurrents, she's an activist within our transgender community, and she is also working at the Damien Family Healthcare Center. Leilani.
So good morning everybody. So thank you. On behalf of Amita Care, I'd like to say thank you to everybody that showed up today to support as well. Thank you to the Bronx Borough President for being so supportive in everything that we do in the Bronx. I'm very fortunate as a woman of trans experience to be working for a healthcare organization where I'm the first person of trans experience to be part of that organization and be employed there. So I'm very fortunate to the Damien Family Care Center for bringing me on board. I'm also very fortunate to be living with HIV since 2006, looking this amazing in care. Yes, that's right. That's right. Since 2006, I've been living with HIV, and for the past 7 years, I've been a spokesmodel on the HIV Stops With Me campaign, living, thriving, and surviving and breaking stigmas to what it's like to be HIV positive and to be able to gain employment. I'm also a woman of trans experience, showing you here, as well as some of my other fellow sisters and brothers that are in the building, that it is possible. It is possible to gain employment, educate yourself, be in those influential roles. Don't let nobody talk for you. You talk for yourself. Don't let nobody speak your truth. You speak your truth. I'm also very fortunate enough to be also the Chief Operations Officer to the New York Transgender Bodybuilding Federation, the only, and hear me very loud and clear, the only trans sport in the world inclusive to just not trans individuals, but the cis population. And in August, we will have our first pro competition. So definitely go on to nytbf.info and check us out. I have many other things to say. Listen, if you guys are in need of care, we at the Damien Family Care Center, just like all of our other, medical allies, are here to support you guys. Please definitely stand up. And when I tell you, it's possible. It's possible to be HIV positive. It's possible to transition with the support of your medical care, your insurance companies like AmitaCare. They've helped me. They've been my partner along the way. And when we didn't find things that they were going to cover, guess what? We sat at a table and we spoke. And we figured out how to make these things happen so that the next people after us and after them have shoulders of giants to stand on. So let's be those giants. My allies, I want you to stand with me, support me. My siblings, I want us to stand together and support one another, because with support, education, and knowledge, the grounds are endless, people. So thank you, thank you. And let me tell you, get into care. If you're HIV positive and you just found out you're HIV positive, check us out. Reach out to one of us. Reach out to me. You can catch me on social media. I have a web show every Sunday. You can catch me. But it is possible to thrive, survive, and look this damn good with living with HIV, because she's a passenger in my car. And every time I slap her and I let her know, I remember you there, girl. But I take a pill every day to keep you under control. So thank you. I appreciate it.
Thank you, everyone, for today's amazing press conference. Again, we want to thank Destination Tomorrow for hosting us today. Borough President Gibson, the proclamation.
So thank you, everyone, and we really hope that you take advantage of all of this information. There is nothing greater than sharing information, than helping to educate our brothers and sisters. And so today that we recognize as this National Transgender HIV Testing Day, understand that we do this work every single day. When you hear the powerful stories of Leilani, who is using her own story and her own testimony as just a showing of strength, she is a source of encouragement and strength for so many others in our community that may not see the work we're doing. They may not be strong enough to take that first step and say, you know what, I need to get tested, or I found out that I'm HIV positive. I don't know my next steps. We want to be that source of encouragement for those out there that need our support. I cannot emphasize the importance of this work, and we need our allies in the media to help us using your own networks and your audiences of residents. We need you to share this information on social media. We need you to help us so that we can help the residents of this borough. We want to keep people healthy and safe. And as you see, Leilani looks good. There is nothing impossible. You can live with HIV. It is not a death sentence, but it is truly, truly about your rebirth, right? I say it's a rebirth, because oftentimes we have so many setbacks in life. But I remind all of you that setbacks in life are preparations for a comeback. Every setback is a preparation for a comeback. And we need to use our voices to amplify the voices of those out there that may not be as strong to come forward. We need to give people hope when they feel hopeless. And so it is my honor as the Bronx Borough President to officially proclaim today, April 18th, 2022, as National Transgender HIV Testing Day in the Boogie Down Bronx.